the design weaknesses of the American healthcare system, and a suggested remedy. The U.S. is the only country out of 37 nations in the Organization for Economic Cooperation and Development that doesn't have universal healthcare, and the only developed country that relies on private health insurance. Healthcare is a big issue, as 26.4 million people lack it, and Americans believe it should be the federal government's top priority. We have a mixed system consisting of private and public government-subsidized health insurance programs that lacks both universal coverage and a central governing agency. It is financed by public entities like the government and private insurance companies. The flaws of the current U.S. system. The U.S. spends more than every other OECD country and 40% more than other high-income countries, but still has worse outcomes than these countries. The high cost of health insurance and care contributes considerably to the national debt, as 24% of the federal budget for 2022 was provided to the Department of Health and Human Services. The cost of health care causes many to delay receiving care, as 1 in 3 adults report them or a family member resisting getting recommended treatment because of cost. The U.S. allocates 30% of every healthcare dollar to administrative costs, twice the amount of Canada, which wastes money and time, as 20 to 30% of physicians' capacities are swallowed by administrative tasks like clinical documentation and more. Uninsurance causes 44,789 yearly deaths, or a 40% increased risk of death if uninsured. Marginalized communities experience difficulty affording necessary care, meaning some must pay expensive bills out of pocket. Private health insurance often contains many exclusions, such as pre-existing conditions, and doesn't extend to non-acute treatments like regular eye care. Healthcare inequality is caused by income inequality, which also accounts for many rural and impoverished areas lacking primary care physicians, as well as reliance on private insurance, rising healthcare costs, and many of the poor not qualifying for Medicaid. Costs disproportionately impact the uninsured, those with lower incomes, and Black and Hispanic adults, with 60% of them reporting having difficulty affording costs compared to only 40% of white adults. The poor are more likely to be sick, as the top 1% of males live 15 years longer than the poorest 1%, with the difference for women being 10 years. The lack of federal-level health planning results in a wide range of state-planned outcomes, varying from zero planning to very stringent. There's a fragmentation of our system, and this, as well as the lack of integration between critical agents like public and private health providers, hospitals, decision-makers, health and social care organizations, and patients, was exposed by COVID. If the U.S. had prioritized cross-sectoral communication and integrated measures, COVID policies would have yielded much more favorable results. In 2020, 3.1% of hospitalized fatalities were preventable, totaling to 22,165 annual preventable deaths. The U.S. has the highest amenable mortality rate, as well as the worst quality, access, efficiency, equity, and healthiness ratings among 11 countries at 112 deaths per 100,000, a rate that is twice those of Switzerland, France, Norway, and Australia. The total cost of medical errors may cost about $1 trillion. Design changes that I believe will target the current system's shortcomings. Universal automatic single-payer coverage financed publicly by the government, covering registered immigrants, asylum seekers, and undocumented children, provision of a mandatory insurance covering long-term care, and provision of a guaranteed basic income in the event of income loss due to illness. The right to health has been recognized as a human right multiple times by the UN, for example, both in 1948 and in 1966. Pope Francis recognized it as a human right in 2021, stating, "I saw once more how important it is to have a good healthcare system that is accessible to all as it exists in Italy and in other countries, and that health is not a consumer good but rather a universal right, and therefore access to healthcare services cannot be a privilege." A single-payer system would save about $37.8 trillion. Medicare for All, a Universal Coverage Act, would save about 17.7% compared to the current system, resulting in a huge take-home pay raise and large tax reduction for most workers. Middle-class taxes would increase, but the total direct costs would decrease as premiums and out-of-pocket expenses like deductibles and copays would be eradicated. By cutting administrative costs, Medicare for All would save about $600 billion a year and would cut current U.S. spending on administration, which totals to $812 billion, by 75%. Americans' tax burden is as high, if not higher, than citizens in countries with universal health care due to the hidden health care tax many pay to private insurance companies. Under Medicare for All, Americans would pay 9.6% less than they currently contribute to the healthcare system. A universal system would prevent bankruptcy, which is very valuable to citizens who get sick, cannot work, are left with no income, and thus are unable to afford standard expenses like car and house payments or food. Universal healthcare not only ensures everyone has insurance access, but it has also been shown to reduce mortality in other places. Medicaid expansion has improved preventive care and financial security for disabled adults. Governments are responsible for the financial burden of expensive care resulting from preventable, non-communicable chronic disease-caused complications under universal systems, and therefore they may be incentivized to provide prevention of those risks prior to the onset of the complications and to promote large-scale preventive efforts. This concludes my presentation, and I would like to show my sources now as the end. Thank you.